Okay, everyone, thank you so much for joining this call today. My name is Ken Rosenberg, and the star of today's call is Dr. Shermie Cadabona. She's a fabulous acupuncturist in our San Francisco clinic. She works all weekdays except for Wednesday, and today we thought we would try to cover a lot of the common questions people ask about Chinese medicine. So, hello, Shermie, are you with us on the call, unmuted?
I am here.
You ready for some general questions about Chinese medicine?
Sure.
All right. Well, here's a common one we get. When should a person seek treatment with Chinese medicine, or what is Chinese medicine used for?
That's a great question. And let me start by just kind of explaining the type of patients that I see. So one of the places that I used to work at pre-COVID was downtown in the financial district, downtown San Francisco, and I saw a lot of stressed out people. They come to me with musculoskeletal issues, back pain, neck pain, arm, wrist pain, but also anxiety, headaches. Those are probably the top things that I saw there. So Chinese medicine, acupuncture is definitely effective for those types of conditions. In my practice on California Street, I see a different type of patient usually. Since we're here kind of in the center of other medical care, there are patients who I see who are looking for support as they go through chemo. So, we work on helping to support their body through that process of going through the chemo treatments and helping them stay healthier through that process. So, there's a wide range of what Chinese medicine and acupuncture is good for. One of the top things that it's great for is wellness care. So from a Eastern point of view, healthcare is about health, right, and staying healthy. What we have typically in Western medicine is sick care. You go to your doctor when you're not feeling well. So, that has great value in it, of course. I'm not dissing Western medicine by any means, but I think it's really important to let people know that, when you're feeling great, you can also get care so you can, maintain that great feeling and good health. So, so Chinese medicine is really good for a wide range of conditions. So.
Yeah, Shermie, I once heard an acupuncturist describing that, historically in China, acupuncture, the emphasis was preventative medicine, and the doctor was only paid when the patient was well, and they weren't paid when they were sick. And so the model sort of is like stay ahead of illness, come in to maintain health and wellness. First sign of an imbalance, like let's get on it and get some treatment. Whereas Western medicine often is wait till it's a bigger problem and then we can do some amazing heroic measure. And I mean, thank goodness we have that when you need the heroic measure. But sort of the idea is to not wait to that point and come in a little sooner when you have a greater chance to get ahead of the disease, I guess I'll call it.
Yeah, that's exactly right. It's funny, Ken, because I heard that story in school too. We went to the same school, didn't we?
Yeah, I believe so. So you also mentioned like stress, musculoskeletal stuff. Like, do you find sometimes like you can lower someone's stress and their body relaxes, or sometimes you just go for musculoskeletal relaxing muscles and the body sort of comes along and relaxes with it?
How can I answer that? I think what I generally do is I go through a two-prong approach, and this is really what we do in acupuncture and Chinese medicine. It's really hard to target one one condition, because as we work with the body and we correct imbalances, it kind of has a domino effect of correcting imbalances in other places too. So as far as musculoskeletal issues go and stress, what I typically do is, depending on the condition, let's say somebody has low back and shoulder pain, upper back pain as well from sitting at the computer. So depending on the severity of it, I might go with some direct points and apply these acupuncture points at the areas where the muscles are the tightest. Again, it depends on the situation, but that is one approach that I would take, and actually get into the muscle structure to loosen it up. Another approach that I take, which is simultaneous, is to identify the meridians or the energy pathways that pain or tension is housed in, and then I use certain points to help open up those meridians so that the energy can flow through those areas, and that also helps to relax the muscles. Does that make sense?
Excellent.
Yeah.
Shermie, can you talk about how often someone should go for an acupuncture treatment?
So frequency of treatment, we can approach that question the way you would approach dosage in Western medicine. So, for instance, if you had some type of infection in Western medicine, you went and got some antibiotics for it, and they put you on a course of antibiotics for 5 days, for instance. And let's say you only took 1 day of it and decided to not, take any more because you didn't want to or whatever reason. So if you didn't finish that course of treatment, it's highly unlikely that your infection would clear up, right? So with acupuncture, it's kind of the same thing. Again, depending on what the condition is that we're treating, the dosage or the frequency of acupuncture treatments can vary. When I'm first seeing a new patient, I will typically set them up on a course of treatment somewhere around 6 sessions for once a week. That there's nothing magical about that number, but that's within the range when most people will see and feel some results, some improvement in their condition. But the way that acupuncture and Chinese medicine work, the effects are cumulative. So, whatever we do as we're working, it builds on what came before, right? So, because really we're tapping into the body's innate capability of healing itself. And to do that, it's kind of like training a puppy when you have to give it certain commands at the right time and with consistency, right? If you just tell your puppy to sit once and give him a treat, he might remember it, for the next 30 seconds. But if you come back 2 weeks later without any other intervention, your puppy's just going to walk away from you or try to play or whatever and get distracted. So, the body kind of responds that way as well. So with proper timing, proper dosage of the acupuncture treatments, we get much better results and much longer lasting results as well. So what typically happens when I see a patient is like I said, I'll set them up on a treatment plan of once a week for 6 weeks. And then as we progress, let's say after 4 treatments or so, or maybe even 8 treatments, that person is, starting to show some progress. Then at that time, we might reevaluate and say, okay, now we can start spreading out the frequency of treatments. So eventually, we start at once a week. We'll eventually go to every other week. maybe every 3 weeks. Once we're in every 3 to 4 weeks, we're probably already getting into that wellness phase of care that we talked about at the beginning here. And then at that time, people will come in for what I like to call tune-ups. So, if you're feeling pretty good, your symptoms are minimal or maybe non-existent at that time, then, we'll come in. Most people will see me any time between every other week to like every 2 weeks to every 2 months. And it just depends on the person. But what I ask patients to do is to listen to your body, because your body will tell you when to go in for a tune-up. It's like that little check engine light coming on in your car, and you'll just know. So, so that's the timeline of things usually.
Excellent analogies, Shermie. I feel like that's really clear, and I understand it a little better. It sounds like it's not like a one and done thing, but the follow through with the care is sort of essential.
Yeah, absolutely. Every once in a while there will be a one and done kind of thing, but that is usually with very acute conditions. For instance, I treated somebody with, she was a librarian and was having some thumb pain from shelving books and then, working on her phone a lot, playing games on her off time. She just kept having some pain in her thumb. And so I did, actually, as a balancing treatment, I didn't put a point in her thumb at first. I actually put it in a spot between the big toe and the second toe on the opposite side. It was her right hand that was bothering her. So I used this point on the left foot as part of what we call a balancing technique in acupuncture. And, just kind of stimulated that point for a few minutes and then had her move her thumb around and kind of use it, and the pain was gone. So that was a one and done thing, but that doesn't happen as many times as everybody would like it to, but it does happen sometimes.
Absolutely. And that's like an amazing phenomenon, I think, to many patients, is that the needle could be so far away from the problem or even on the opposite side of the body and be highly effective. And maybe if there's time at the end, we can circle back and talk about that, the peculiarity of that a little bit.
Yeah, sure.
In the meantime, let's see, another question comes up a lot is, people are seeing other specialists and Western doctors, and can you talk about the safety of using acupuncture alongside patients seeing other types of providers?
Sure. So I had already mentioned seeing people who are going through chemo, and of course they're working with their oncologists. So, that's one example. I think having more than one provider to help support you through a health issue can be really helpful. I mean, that's what our approach with integrative medicine is all about, right? So, another example is Scott Larson and I work in the same office. Scott is a chiropractor, and there are some patients who see the both of us, and with the combination of chiropractic work and acupuncture, we've seen some great things happen. It's just really, for musculoskeletal issues, that combination of chiropractic and acupuncture, or even physical therapy and acupuncture, or even all three together, I've seen some amazing results, and people bounce back from injuries much faster than if they had been doing one modality, through their recovery.
Yeah, it certainly does seem to expedite the outcome, and really, for really stuck problems that aren't responding, it really gets things moving and the patient progressing forward. There's something I've witnessed working here for almost 10 years now, where you see patients come in and they're seeing multiple providers, and all of a sudden they're sort of like showing up for themselves and invested in their healing, and they have a couple providers sort of wrapped around them, holding it for them. You really see people's situation improve, their health and their quality of life in multiple ways. It's really such a joy to witness.
Yeah, it absolutely is. And you've been here with IHH a few years more than I have, and it never gets old. That's the beauty of it.
Okay, so now, Shermie, let's talk a little bit about fear and phobia with needles. Some people really build up in their mind like it's going to be this painful thing. Can you address that concern?
Sure. Yeah, that's pretty common. So when people come in to see me and they tell me that they have a little phobia about needles, in my mind, that phobia, they're already in the mind space to overcome it, because they made it into my office. They're sitting here in the room with me, and they're not running and screaming and clawing their way to get out of the room. So what I do with people who are a little bit afraid of the process is I let them know that what we use for acupuncture is much different than a needle you would come across in Western medicine, like for an injection, flu shot, whatever, the hypodermic needle. So what we use for acupuncture, those needles are much smaller. And depending on the gauge, you could fit about 8 to 10 acupuncture needles within the bore of a hypodermic needle. That's how much smaller the diameter is. So there's that, and it's a different sensation. So if somebody comes in who's a little bit afraid of the needles, depending on how they react to it, some people will welcome my invitation to take a look at a needle first, and some people just don't want to see it at all. So I let them, just take that course wherever they need to be with it. But the people who are curious enough to take a look at what the actual acupuncture needle looks like, many times once they see it, if they're, apt to do that, a lot of times their anxiety of it drops right from there, because they can see what it is that we're dealing with and how small it is, and it's about the diameter of a human hair. So there's first seeing what we're working with, and then I'll explain I'll explain what the sensation would be like. So most of us have had flu shots or other types of injections. We know what that feels like, and it's not very pleasant. But, with acupuncture, when those points are placed, what we do is, it's so much thinner. So there might be a little bit of a pinch or a poke, but it's momentary, and it's not on the same degree as if you were getting your flu shot. I know I keep saying flu shot because it's flu season, flu shot season, so that's top of mind here. But anyway, so that sensation is going to be a little bit different for people. And so, when we get around to actually starting the treatment, once the patient is, set up on a table, very comfortable, when I place that first point, I would say 99.99% of the time, the reaction is, oh, is that it? It's so anticlimactic. And then after that, we're good. So, if people who are afraid of needles, but are still curious about acupuncture, let them know it's really not a big deal. And the results are great. The sensation in the moment is, it passes. And like I said, it's just like a little pinch or poke. Sometimes you don't feel it at all. So, everybody's a little bit different. But if that is the one thing that is holding people back from seeking out an acupuncturist or trying Chinese medicine modality, then, that is something that can be easily overcome.
Yeah, it's funny that you said that you're 99% of the time people say, oh, is that it? I kind of laugh to myself because I hear the exact same thing. And I actually find the people that are the most worried about it do the best because in their mind they've built it up as being, it's going to be so bad. And then they go, oh, that's it? And then it's very relaxing. A lot of patients fall asleep. But also I really tell patients, like, it's not acutorture. It's your body. You have agency over your body. It's not lay there and take it. Like, we really, if someone really is sensitive and phobic, we work with them. You go slow so their body knows it's not under attack. And, maybe we do less needles or even smaller gauge needles. I mean, they're already so fine. But there's times where we pull out even smaller ones. And we really work with the person to individualize it to their comfort level. And it could still be very effective without having any strong feeling.
Right. And that brought to mind another thing that I do. If somebody's really, really afraid and they've kind of got they're almost flinching, even when I'm just touching their wrist to take their pulse, then I would start them off with a little Qigong breathing exercise to help them get grounded and get into their body. And, just to be okay with just feeling physically, just feeling. Because sometimes that's really where the fear lies, is just that fear or the anticipation of what this sensation will be. And it's, for the moment unknown until that first point goes in.
That's a really awesome tool to be able to offer people, because I'm finding even in people that, they're not scared, they're just, everyone's so busy and rushing around and they're squeezing their visit into their workday between meetings. And there's just like a momentum that to be able to offer somebody that respite, that moment to just kind of arrive into the moment and kind of, become part of the treatment table or the bed and just relax in and be present with themselves is a huge gift. It really recalibrates people back to center.
Yeah, it absolutely does. And I think it highlights what people might be feeling, or actually what they've been avoiding feeling. Like,
yes, exactly.
When they find that center and they feel that relaxation, then you start to realize, wow, I've been really far off of that target for so long. So, but it's also helpful for your body, first of all, for your body to feel the relaxation. And then second of all, to consciously recognize it so that you remember it. Your body's going to remember these things from a muscle memory point of view, because our bodies remember everything. But then to later incorporate that into your life somehow and sort of revisit, that relaxation, and be able to pull into that past experience that you had laying on the acupuncture table of being relaxed and trying to find that, elsewhere in your life when you're not on the table.
So we're approaching 12:30. So I think what I'm going to say, Shermie, is I'm going to give an opportunity if there's anything else that feels important you wanted people to know about acupuncture, and you can either just comment now or we can open this up and see if anyone has any questions. What do you think, Shermie? Was there something you wanted to say?
Yeah, I think the most important thing, because we are running short on time, is something that was touched on a little bit earlier about how It seems that through this process, when people come to acupuncture, they're sort of taught a different way to view their own health care. And so they end up becoming more involved in their own health care. And I think that is super important, not just for going to see your acupuncturist, but for any healthcare provider that you go to. Um, it's not, your body is not like a car that you bring into the garage, you drop it off, and then at the end of the day you pick it up and everything's hunky-dory. You're living in your body 24/7. You're the one who's going to be most able to monitor what's going on with your body and what you're feeling. And, the more involved you are in your own healthcare and asking questions and paying attention to the signals that your body is giving you, then the better your results are going to be, so that you can maintain your good health and, well, first of all, clear up whatever condition might be ailing you, but then move your focus to more wellness and staying well and wellness care.
Yeah, absolutely. Being engaged with the care and sort of cultivating more body awareness, certainly very useful for maintaining health. I think we can wrap up. Shermie, are you feel complete or?
Yeah, I think, I hope I gave everybody some great information, and, hope to see you soon.
All right. Good day, everyone. Good weekend. That was fun. Talk to you soon.
Bye, everybody.